What are we talking about today?
All right. So it is Breast Cancer Awareness Month. So we decided to go with the topic of options of mammograms, ultrasounds, and thermography
And others.
and others. You're right.
And I did make the comment that everybody loves boobies,
You did.
and you questioned that.
Yeah. I was like, are you talking about men here? Because maybe we want them, but
Maybe,
because y'all
maybe.
like them.
Man boobs. So let's kind of start off with some stats, which we were going over before. So hit me.
Right.
What do you got?
Yeah. So super crazy. 1 in 8 women in the US will be diagnosed with breast cancer in her lifetime.
Which is a lot.
Yeah.
And genetic wise, you're kind of going over some stuff with that as well.
Yeah, and it states that less than 10% of breast cancers are actually genetic. And that kind of led us up to talking about how 90% are linked to things like the lifestyle,
Mm.
whether that be diet, sleep, stress, environmental, things like that.
Inflammation.
Inflammation is huge.
So the kind of the two main genes that most people know about are the BRCA1 and the BRCA2. There are other genes that are associated with that. So the 90% that aren't genetic, and we were kind of going over some other stats on our first take,
Yeah.
is about, depending on who you talk to, somewhere between 40 to 60% of all other cancers are preventable.
Mhm.
So let's just call it half. So the other half, it is like aging does cause damage.
Right.
Certain other genetic things and things you can't control, it does happen. But I would argue that it's certain things cause cancer, but a lot of times maybe certain things allow cancer as well.
Right.
Right. So I would go probably 60, 70%. I think that would be uh, the preventable range
Hmm.
personally. But
Yeah.
now what about, okay, so well then anything else to add before we kind of get into like mammograms and stuff?
So I know another crazy statistic that I found very interesting was that it can take up to 8 to 10 years before a lump is even detected. So when somebody finds a lump, I hear them come straight to us and say, kind of, what did I do? Or when did this happen? And
Right.
they think that it was around the time that they found it, right? Because technically they didn't feel anything or ever couch anything before that. If you really think about it, to 8 to 10 years before that, and you think of what age a woman found this particular lump, it's really
Yeah.
mind blowing about the typical age that most start.
It is. Yeah. So it's kind of, obviously I don't have breasts, but from one perspective, knowing that you have 8 to 10 years, it can be kind of daunting because like, man, I got to be good for like a long time. But on the
Right.
other hand,
Right.
it's also empowering because we have that long to actually make a difference and change things.
Hmm.
And that's kind of where some of the other possible screening methods
Right.
come in, right?
Exactly.
Because mammograms are definitely not infallible. There's actually a lot of downsides to them, and probably I
Hmm.
would say most of the patients that we get for when it comes to cancer or just kind of prevention, they actually don't want to do them.
Right.
Do you find that a lot? Or they
Yes.
feel like they're maybe kind of stuck between a rock and a hard place?
Yes. I feel like they don't want to, but they also are being bullied or, given no other option until they come here. And then just us giving them that validation,
Yeah,
I think just kind of helps them.
yeah. And what do you hear is the most common reasons like they don't want to? I really have kind of two that I hear.
Well, honestly, if you do ask most women, it's
Yeah,
scary and
yeah.
they heard it hurts.
Yes. But the two reasons I hear is I don't want to get cancer from it because it's radiation,
Yep.
right? And it's painful.
Yeah.
So I kind of have statistics here
Yeah.
because on the cancer thing, right? So typically the age kind of ranges that a lot of women start getting mammograms, so it is a little bit dependent on that. Now, something that I do want to bring up is if they do find something, well, now it's not just like a once a year, every 2 years type thing. Now they're doing it every 6 months.
Right.
Right? So
Right.
now the potential for cancer does go up.
A
So a couple
lot.
studies that I found in the UK was it somewhere around 1 in 7,000 get cancer as a result of the radiation.
What
And
happened to their
then
oath? Do no harm.
yeah, yeah. So it is a little bit of a pick your poison, I
Right.
suppose.
Right.
But I do think, which we'll get into, I do think there's definitely better options. Now, disclaimer, we can't tell you don't do mammograms because they are considered standard of care. So we
Correct.
will never tell you to not do them. But you do have to, we do recommend you be informed and you got
Educate
to make your own
yourself.
decision. Because One of the big things with mammograms is how accurate are they? And a big thing that we see is false positives.
Mhm.
So,
False positives, unnecessary biopsies, which give a
right,
lot of people anxiety, so I think that's when we see them, yeah?
well, for sure.
Yeah.
Yeah. Or do I get the biopsy or what's next?
Yes, that's where
Because,
they
yeah, because
very
especially
hard.
depending on the doctor or facility or hospital or wherever that you're going,
Mhm,
it's like, this is what we do. There's no other options. It's
mhm,
like, well, wait a second. Like, I've
mhm,
heard of a lot of other things.
mhm.
Because you were telling me that dense breasts make a difference.
Yeah, a lot,
So,
especially because if you think about when women typically start getting mammograms, right? For different reasons, it could start earlier,
mhm,
but really it could start in their 30s or even 50s, which this is when we are going through that lovely stage in our life called perimenopause. So
yeah.
that gives a lot of estrogen, which causes dense breast, which, like you had mentioned, leads to a lot of false positives.
Is there any type of number on how many false positives there are, or how many women actually have dense breasts?
Let's see what I have here. Around 60 to 70% is stating having dense breast.
So that is a lot of false positives.
A lot.
Yeah. So I think it's the statistic was like 50% of people with dense breasts will get a false positive or some sort of misreading.
Yeah.
And then
Yeah.
so
Yeah.
that's
Yeah.
so 50% of 50%. So 25% of people will have some sort of kind of skewed reading.
Yeah.
And then, uh,
Yeah.
so what are other options for mammograms?
We have two different options. One is an ultrasound and one is thermography. And we give our patients a great resource, the OC Breast Wellness Center.
Right. And so I think they're in Fountain Valley. That's who we usually
Yeah.
like.
And they do both. And you can go on the website and see the prices for the different options. And they just included something, which I found out from one of my patients, that they're now interpreting it for them. You can
Hmm.
pay to have that interpreted, which that's new.
And they do also have SureTouch, which is it uses like a very sensitive. It's kind of like palpation, right? So like
Mm-hmm.
feeling,
Mm-hmm.
and so kind of interesting. Not very interesting, but do self exams because about 20% of all breast cancers are felt with self examination. So just soap up good if there's any.
I think that is the most important thing because, like, my pet peeve, and I know everybody has pet peeves, my
Right.
pet peeve is if you don't know yourself, nobody else is. Like, if you
Right.
do not know your body, nobody else is gonna know it. So I always, I always, 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 always make that something that you should know. Touch yourself, look in the mirror.
Yeah.
Like, you need to know yourself better than anybody. So you need to know what is normal for you. And if you are going through that crazy perimenopause stage that you are getting these lumps and bumps that you just don't know what is your norm at that time, do it after your period. So that way you can actually know what your norm is. So when you get those lumps and bumps, you're like, those are from my hormones, right? And then they'll go away.
Yeah, because it will change.
Yeah, they do.
Yeah.
So really just get to know yourself. And people always ask, well, why are you telling me to look in a mirror? Because abnormal skin changes or dimpling, that's like the number
Like
one
gets like
sign
a
that
little
most people,
pucker or
yeah,
something. Yeah.
people
Yeah.
really don't know what they're looking at.
Yeah.
And if it's abnormal for you, red flag.
Yeah. So a little bit, so along the same lines, but also contrary. So I have had about 3 or 4 patients, or actually the husband,
Amen to that. Hey,
because
100% they know us
yeah,
best as well. I get that.
yeah.
Yeah.
And so ultrasound, pretty kind of self-explanatory. I honestly, like for me, and so like my wife, my mom, they do the SureTouch, they do the thermography. The thing I like about the thermography is it shows you inflammation, which
Yes.
is like one of the big precursors. So that 8 to 10 years before,
Yes.
where do you have any hot spots, right?
Yep.
And is there inflammation? You can kind of do things to decrease inflammation. If they find something on a mammogram,
Yep.
really what they're going to do is they're going to either do an ultrasound, an MRI, or a biopsy. Now, the problem I have with biopsy is potentially if there is cancer, there's kind of that thought like if they will puncture it, rupture
Yep.
it, well, does it spread that? And like ultimately, if you have abnormal breasts at all, right? If they're dense, if they have like a cyst or something, and you're
Mhm.
going to get an MRI or an ultrasound anyway, why are we doing the mammogram to begin
Thank
with?
you.
It's just maybe I'm jaded, but I do feel like it's kind of like a money grab, just like oh
My
everybody
patients
does
ask
this.
the same questions. They're like, if they find something and then they tell me, oh, now you need to go get an ultrasound or do this or this, they're like, why
Yeah,
can't I just follow up with the same thing? We ask the same
yeah,
questions.
yeah. And for me, especially like insurance, it's a racket. Like if you go for an MRI and a bill through insurance, like you're
Right.
like, "Oh, a $3,000 bill, right?" Or whatever it was. But if you find a place and you say, especially if you go through like a doctor's office or something, they often have relationships.
Mhm.
Like if we send a patient for like let's say a breast MRI, it's $400. So just jump right to the MRI, right? It's more detailed to get more information, to get sizing, all that stuff anyway. So as far as supporting breast health, what would you say kind of are the main things?
Definitely, again, we go back to all those things that we just talked about in the beginning. Lifestyle, supporting especially your hormones. So eating whole foods, less processed foods, right? So the bad oils.
Yep.
Um, Definitely eating your vegetables. Not just something your mom or dad would tell you, but the cruciferous vegetables like broccoli and cauliflower.
Yeah, potatoes don't count as a vegetable.
French fries?
No, definitely not.
Oh, our patients are gonna
Yeah.
like that one. No, definitely in all aspects, like I said, moving your body. So exercise is incredibly important. I'm constantly talking about lymphatic drainage to every
Yeah.
woman that I can, especially with those dense breasts. You want to keep that lymph moving. So like the dry brushing, I always talk about the infrared sauna.
And really, that's all detoxification, just clearing the crap out.
Right,
Yeah.
right. And then my favorite subject of all time, everybody knows, is toxins, because nobody talks about them. And I love using the word
Yeah.
endocrine disruptors because not a lot of people know about it.
Yeah.
My poor children know it by heart now. But, downloading the EWG app and just making sure you're switching over, especially those deodorants where, hello, in the
Yeah.
area. No underwire. I mean, me personally and my girls will never own an underwire bra.
Mhm. So a
And
lot of people don't know why. Why not an underwire?
well, if you think about it, what it's doing to that area is cutting off that blood flow, the circulation. And again, it's all about the lymphatic and keeping things
Yeah.
moving.
So nothing can go down. It's just like you're
Correct. You're just
a tourniquet on the bottom of
stopping
your
it.
boob. Yeah.
Yeah. And if women know how that feels, we all know how that feels. You just want to take it off immediately, anyways.
Yeah.
Free yourself. I mean, that's what everybody does when they get home, right? Take it off.
Free boob it.
Yeah. So honestly, just don't buy underwire anymore and you're free during the day.
So it might be too much information, but so my wife's routine when she gets
She's going to kill
home,
you.
yeah, she is, but it's not too bad. So her routine when she gets into like her jammies, right? So she
Yeah.
takes off her bra and she doesn't wear the underwire. But her thing is, so she stretches and then she goes like it's kind of like she's like stretching them out, like
Yeah.
get the circulation going again.
They've been cramped all
For
day.
sure.
Yeah.
Yeah.
I definitely don't have that problem. We are in the itty bitty titty committee club. So, I got other issues, people. So,
Right.
when you talked about liking them, wanting them, yeah, it's that I want them thing. Yeah. But hey, I
A
have
lot of
so many
women are
things
it's a
not to
love
worry
hate.
about.
Yeah.
Okay. So maybe I'm at the advantage here. Who
Yeah.
knows?
And anything else to add to yours? Because there is something else that I want to,
Bring it up. Let me hear.
yeah, breastfeeding.
Yes.
So breastfeeding is actually really, really huge. So some interesting statistics on this. So for every 12 months of breastfeeding, your risk of breast cancer goes down by 4 to 5%.
Yep.
Now, if you're under 6 months, it is very minimal. So if you have 6 to 12 months, it's a 5 to 10% reduction. If you breastfeed for 12 to 24 months, it's a 10 to 15% reduction. And if it's over 24 months total in your lifetime, it doesn't have to be continuous.
Right.
It's about a 20 to 25% reduction. And what's interesting is kind of how that works. So, and kind of with it, so number one is it's your hormones change when you're pregnant and you're breastfeeding.
Correct.
So that does change.
Correct.
When you're breastfeeding, the type of tissue in your breast actually changes.
Correct.
And then when you stop, it's kind of like flushing and detoxing. So while you are milking, right? So you're
Right.
it's a way of detoxing, and kind of the opposite of this for males is actually prostate cancer. So for males that have had vasectomies, because you're not emptying, right?
Mm.
There's about a 10 to 15% increase in prostate cancer if you have had a vasectomy.
So I need to tell Jesse to get his removed or reversed.
Are you wanting more kids?
Maybe.
Are you? Oh my goodness.
Hey, I need to keep breastfeeding and keep my wrist down. Just kidding.
So
There's
yeah,
an
so that's kind of the main points on this. Do you have anything else?
there's another really cool statistic. I do not
Mhm.
have it up in front of me, but a huge one is the age at which you get your first pregnancy.
So
The
what is it?
younger you are,
Yeah,
the higher chance of you not getting breast cancer. So anybody
yeah,
over 30, you have a very high risk of getting breast cancer. But the younger you
gotcha.
are, so I win in multiple ways. Thank you. I
I
did it
mean,
on
that kind of
purpose.
makes sense, right? The earlier that you can essentially detox like a giant, getting flushing out all those toxins, the longer that you have those toxins kind of building up in your
Yep.
system and sitting there,
Yep.
the more likelihood that it causes problems.
Yeah.
So that definitely makes sense. I had not heard that one.
Yeah. I read
Interesting.
it in that book that I'm reading. So I don't remember the exact age that
Yeah,
it said below, but I know 30 and above, huge risk factor.
nice. Another thing that can influence a breast cancer is actually chronic infections as well,
Yes.
whether it's viruses such as HPV, hepatitis C, B, Epstein-Barr, H. pylori, liver flukes, gut dysbiosis, and really the core of all of those things is immune system dysregulation,
Right.
and probably more importantly, inflammation.
Inflammation.
Yeah. What are your? This is a little side note.
Yeah.
What are your favorite inflammation markers, or do you have favorite ones?
I mean, honestly, I don't have a favorite inflammation marker, but CRP is one of the best ones to look at to kind of just
CRP,
understand.
and so probably my favorite one is homocysteine.
Well, yeah, that's a big one. Because then you get the mother effer gene out of that one.
Yes, oftentimes you do. All right, anything else to add to this in any of your notes or any little tidbits here?
I just think when people hear about mammograms, they're thinking it's preventative, and I think that's false. How do you feel about that?
I agree.
Okay,
It's reactive, is what it is.
correct.
Doesn't mean you shouldn't do screenings.
Correct.
I think there's better types, but yeah, it is purely reactive.
Right.
And this is kind of one of the things that I like to tell patients is your body has an amazing ability to compensate like crazy until it doesn't. And once it
Mm-hmm.
doesn't, it's kind of like falling off the edge of a cliff. And that's kind of often
Mm-hmm.
at the point when people come in to see us is like, I haven't changed anything. Why all of a sudden now? Well, your
Mm-hmm.
body can't compensate anymore.
Right.
And once you get the cancer, not that it's too late, but in a certain respect, like, well, it is kind of too late, right? You haven't done all the things to prevent it.
Right. And that's
So
why this whole month, Breast Cancer Awareness Month, is honestly
I feel like it's a
not
little bit
what everybody
misrepresented.
thinks it is.
Yeah, no,
Yes.
I
And
agree.
it's not about finding out you have breast cancer. It's honestly about preventing it. That's what it should be. And I
That's
think
what,
that's
yeah,
what we're doing in our practice is true prevention. And that starts with what we've gone over, lifestyle.
yeah, yeah, it really is it.
Yeah.
Which are many aspects to that, and
Correct.
one of the core aspects of that, always, 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 gut stuff.
Yep.
That's where you got to start. Yep.
Yep.
All right. Well, good talk.